election time.
We're coming down.
We'll do the voter ID thing, and we'll do this. And there's a big fight over Medicare and Social Security now between the two presidential candidates.
Okay, well, you know, Medicare. That's one of those parts of the government we're not supposed to talk about, really. We're not supposed to cut any funds from. And I'm telling you, I'm approaching being a senior citizen, and I'm still concerned about where the money's going to be if I want Medicare. So what's our current administration saying about Medicare?
Well, in 2009, President Obama said that in 8 years, which would make that, I guess, 2017, that Medicare will be in the red. It will be broke.
Well, it's nice he's saying that, because even if he got reelected, he'd be out of office by by 2017, which means it's not my problem anymore. I'm going to go back for the speaking tour.
So he said, well, it's truly risky to do nothing, and so this is a serious problem. And that was in 2009 he said that. But the administration hasn't really come up with any method for dealing with it.
Well, they did pass the Affordable Care Act. Well, how isn't that going to help Medicare?
Well, conversely, the Affordable Care Act took $716 billion.
Right, I do know that number.
$716 billion from Medicare to put it into Obamacare. Otherwise, because they said, well, Obamacare won't cost anything, which is an interesting theory, because if you're adding 30 million people to a health...
Is that all? I thought it was
more. well, that's probably... who knows? Maybe,
who knows?
Maybe 30, 60, 70 million. But let's say offhand 30. And you're not hiring any more doctors. You're not hiring any more nurses. You're not building any more hospitals, right? But you're going to add 30 million people who don't have a penny, and you're going to bring them in. It's not going to cost a dime. So that's an interesting...
Wait a minute. That's an interesting
mathematical problem. So the way they dealt with that mathematical problem was they took $716 billion from Medicare, and then they put that in Obamacare, and they spread everything out. And they said, well, Obamacare won't start until off in the future. So vote on it now.
I mean, off into the future when the president's not in office.
If we take that $716 billion, right, put it in this, it breaks even. As long as we don't start it for several years. And so that way they were able to say that it won't cost a dime.
Well, okay. Okay. Now,
at that second they made that statement, it didn't cost a dime, because they took the 716
compare and contrast here. Yeah. First of all, the TV commercials were an image of Paul Ryan running an old woman off a cliff and saying, that's Medicare. That's what the Republicans want to do. But it sounds like Obama's already done that with the Affordable Care Act. And he's not, I don't see him pushing the people off the cliff. So what is he doing with 716 million or billion?
No. Well,
716 billion that he's taking out of Medicare that services the senior citizen, provides the drugs they need, provides for the operations, provides for the hip replacement, the heart replacements, the liver replacements. When you're talking about taking that much out of Medicare, it seems as though somebody's already done it. So talking about what somebody might do is a little ahead of time.
Well, I'm just saying there's a counter argument there, but what
is the argument?
Well, I would say the argument was the same thing as the Obamacare argument. It says, like, how are you going to control costs? Well, that was never really stated, how you're going to control costs. But under Obamacare,
because we have to pass it, then we'll know what's in it.
Yeah, and well, it wasn't really passed in a constitutional way. It was never really passed, even though the Supreme Court ruled on it. Right? Mm-hmm. It started in the Senate, and that kind of bill has to be started in the House. So any really constitutional way of looking at Obamacare was never really passed.
But is it a penalty or a tax?
It happened. It happened. But I'm just saying you can't have something like that, because it originated in the Senate, went to the House, then Kennedy passed away, Scott Brown got elected.
So they lost the Senate.
They lost the filibuster-proof Senate, right? So they couldn't
send it back to the House, because the House would have done something and sent it back, and they wouldn't have been able to pass it.
So they had to say, well, it's a budgetary issue, right? Yeah. And so we'll put it through, which is not really under the Constitution. So it was pretty much by fiat. It was more of an administrative, it was like an imperial edict.
It was an imperial edict. Well, wait a minute. There's a lot of those imperial edicts have been coming out of the White House.
So it wasn't really, a law per se, but then the Supreme Court looked at it and said, well, even though it didn't start in the right house, you know, whether it's a tax or not.
Well, yeah, so we kind of covered the Justice Roberts factor on this one.
So it's kind of come through, but it's kind of an interesting edict anyway.
But wait a minute, what do the Republicans intend to do? What do the Republicans intend to do with Medicare? Are they really going to push Granny over the cliff? Is it really going to be Paul Ryan's minions that push millions of seniors over the cliff? What is really going to happen here? And why do I keep hearing that they're going to do that? What are they actually going to do?
Well, the charge from the liberal side is that the conservatives or the fascists or the Paul Ryans are going to do a voucher system, which I don't really know what that is, but they're saying that there's a difference between what it's going to cost to service a patient and what Medicare will cover of $6,400, right? And that was based on a CBO report and that kind of thing. That actually is not an accurate statement, but it sounds pretty good. So that's where they get the wheelchair thing. What the Republicans, or what Ryan has proposed, is what they call a premium support thing. It was kind of coverage, which is the same thing that I think the president has and the Congress has. It's the federal employees.
But the Congress has the best health care in the nation.
Well, let's
not forget that.
They're proposing
cradle to grave, effectively.
They're proposing that a premium support as an alternative to your regular Medicare. So if you're 55 and over now, you can have your regular Medicare, but at a certain point in the future, you would have this choice of taking this premium support, which essentially looks like you get a little more extensive care. And you would kind of have you'd have your Medicare would be supplemented compared on the cost, so it would float a little more. Whereas if you have your regular Medicare, you go and you pay a fee and you kind of get the standard care.
But wait a minute,
So the premium support gives you a little more freedom of your treatments, I guess.
But can you choose your own doctors?
But yeah, it gives you more freedom that way, but it costs you a little more.
Well, I understand under any Medicare program, there's a lot of doctors that are leaving the networks because not only does the Affordable Care Act push down their reimbursable fees for each of the services under Medicare, but because the Affordable Care Act, you have to see so many people and there's so many increased documentation regulations,
right,
that in fact doctors are leaving Medicare, are servicing Medicare clients in droves. In fact, there's been a huge push by the American Medical Association to try to do tallies on this. And they're showing there could be up to a third or more of doctors that are automatically dropping all Medicare treatments that already present it right now. So it's just not that. But then there's the whole question of the Ryan plan. I do understand the Ryan plan where they say everyone that's 55 and older still gets to keep their current Medicare plan if they believe it. But right now, there's not just Medicare, but there's the supplemental care programs you get from a variety of insurance companies. You get them from AARP. You get them from Hartford. You get them from a lot of different companies that provide supplemental health care to your Medicare right now. So when Ryan's talking about 55 and over, you can still maintain that. That means you should be able to still maintain the quality of care you expect today with maybe a minimal cost as a associated insurance program that goes along with Medicare. Those 55 and below, there is talk of a type of voucher system where you get an allotment of cash so much each year that you can use for your medical treatments.
That's what they're calling the premium support.
Yeah, it's a premium. And it's interesting about that. There's a vast majority of people from 55 to 70 that may not be even exercising their full value of care. So even if they start Medicare, they push Medicare to 67. Who's to say that 67 to 75 that you're going to be overusing or you're going to be delinquent on you won't have enough money to go to your health care? Because of the aging of the population and the healthy lifestyle that actually more and more percentage of the population is living, there's a good opportunity right here for a combination of factors to protect Medicare, to fund Medicare, to ensure there's enough funds. But once again, it's not throwing Granny over the cliff. I think the clarification needs to be what's really going to happen with the providers, the health care providers, when they're gone. That's more of a scare than if we're taking money away from health care, because then you won't have any providers to provide those services.
Well, with any state-run enterprise, if you saw, any 5-year plan, you always have that problem because, you don't really have a supply and demand because you say, it shall be this way. It's kind of like the Chevy Volt, it's like you shall make Chevy Volts.
Well, the Chevy Volt. There you go. That's a whole nother Anyway, thanks, Mark. It's been a great show.
Okay.
And I got to tell you something. We have to keep going back because this election that's coming up in November is going to be the election of a lifetime for both of us.